Hello, thank you for viewing this presentation. You've requested to review information regarding implant dentistry. Our goal is to inform you about the benefits of replacement teeth supported by dental implants. We're here to assist you in your decision-making regarding your own dental care. For many of us, our own natural teeth do not survive many years of daily use. Whether due to cavities, gum disease, or injury, our teeth may need to be removed before their time. When this occurs, we're faced with a variety of treatment choices. One of these choices involves using dental implants to replace the missing tooth. This allows us to place a new replacement tooth on the dental implant. While there are a number of acceptable treatment options, using dental implants as the foundation for the replacement tooth will most closely duplicate the form and function of your original natural teeth. The treatment process is generally quite comfortable and performed in a series of short office appointments. If you're missing all of your teeth, dental implants can be used to support a specialized denture, which is more stable and retentive than a conventional denture. You'll feel more confident with an implant-supported denture and be able to enjoy many of the foods you previously avoided. Your teeth affect your whole body. A missing tooth can affect your bite, speech, and eating choices. As you rely on your remaining teeth, you increase the chance they'll wear prematurely or be damaged or lost. You may also experience headaches or jaw pain. Losing a tooth can also hurt your appearance. The good news is that most of the time replacing a missing tooth is not an emergency. You have time to consider what replacement option is best for you and to make an informed decision. If you're missing one or more teeth and choose to have it or them replaced, several treatment options are available. A fragile, temporary, and inexpensive solution is a removable plastic tooth with a plastic retainer, often called a flipper. A less fragile option is a removable partial denture cast in metal and held with wire clips. A fixed bridge is held in place by its neighboring teeth. This requires removing or grinding down the surface of healthy teeth on both sides and placing caps or crowns to support the replacement tooth. In some cases, a Maryland bridge can be cemented to the back of the adjacent teeth. In this case, little or no tooth structure needs to be removed. The most common solution for people missing all teeth in one or both jaws is complete dentures. Some people adapt well to these. Others find them uncomfortable, even intolerable, because of differences in jaw size and shape and their own ability to adapt. Dental implants can be used to replace one tooth or all of an individual's teeth. In many cases, they're used where substantial bone loss has occurred, preventing a comfortable denture fit. When teeth and their roots are lost, the supporting bone is no longer needed, so your body allows it to be lost. Over time, this resorption process affects the fit of a denture. Dental implants safeguard your bone structure, oral health, and appearance. They are artificial root replacement structures placed in the jawbone to provide support for dentures or as anchors for missing teeth. Implant-supported teeth can be cemented, screw-retained, or removable, and can be made attractive, stable, and comfortable for almost any patient. Dental implant treatment is a team approach that includes the patient, the implant surgeon, and the general or restorative dentist. The implant surgeon performs the actual dental implant surgery, but it's the dentist who creates the crowns, bridges, or denture that will be placed over the implants. The team works together, reviewing x-rays, consulting, and determining the number and position of implants in order to plan the most comprehensive treatment possible. Most patients are candidates for dental implants. A thorough dental evaluation, including review of your medical history, will allow us to determine whether an implant-supported restoration is suitable for you. The best way to describe a dental implant is to compare it to a real tooth. A natural tooth consists of a root and a crown. The part of the tooth that you see and eat with is called the crown. Beneath the crown is the root, which anchors the tooth through the gum tissue to the jawbone. When you lose a tooth, you lose both the root and the crown. To replace a tooth, we first have to replace the root. A dental implant is essentially a new root. This titanium root is fitted into a socket that we create in your jaw, replacing the lost root of your natural tooth. A support post, also called an abutment, will be placed into the implant itself, and then a new crown will be made and placed on top. If all of your teeth are missing, a variety of treatment options are available to support the replacement teeth. This office procedure to place a dental implant usually takes about an hour for one implant and usually no more than 2 or 3 hours for multiple implants. The placement process consists of the following steps. If indicated, you'll be given medication prior to the surgery. You may prefer to be sedated using nitrous oxide, frequently called laughing gas, or intravenous medications. Then a local anesthetic will be administered to numb the areas where the implant will be placed. Occasionally, general anesthesia is used, and the patient is not conscious during the surgery. After you're comfortable, a small incision is made into the gum tissue, revealing the bone into which the implant will be placed. Using special instruments, a socket is created carefully, avoiding damage to the bone. The titanium implant is then inserted into the socket. Finally, if necessary, sutures or stitches will be used to close up the gum tissue. Implants can be placed at the time of extraction, but usually we wait approximately 3 months after tooth loss to place the implant. If the tooth or teeth have been missing for some time, the jawbone becomes smaller. Implant placement can still be accomplished with the occasional need for additional procedures to help build up the jaw. These procedures, referred to as grafting, are usually relatively comfortable and performed in the office. A sinus lift is a grafting procedure which is usually needed when upper back teeth have been missing for some time and the sinus, a hollow space in your upper jaw, has enlarged, causing bone loss. This office procedure is done either before or at the time of implant placement. If you're missing all of the teeth in your lower jaw, you may consider a number of treatment options. Although many patients have no problem wearing an upper denture, some find it difficult to wear lower dentures. The first option is to have 2 implants placed in your lower jaw and a denture made that snaps into these implants. This option allows your lower denture to be more stable while chewing than without implants. This is a viable option if your jaw's support ridge is big enough. There will still be movement of your lower denture, however, and you can still get sore spots if any food particles, especially seeds, are caught under it. As with all removable replacement teeth, you will still need periodic appointments for denture adjustment. A second option involves placing 4 to 6 implants, depending on your jaw size or shape, into your lower jaw. After healing is complete, the implants are connected with a custom-made support bar. Your denture will be made with special retention clips inside that attach onto the support bar, allowing the denture to snap firmly into place. This is called an overdenture. The advantage of this option is that it's much more stable than the first option, allowing very little denture movement. Your denture still will be removable for easy cleaning and maintenance. A third option involves placing 5 or more implants in your jaw and attaching a permanent denture. Your denture is held in place by screws or clasps that secure it to the support posts or bar. It doesn't touch the gum tissue, which allows you to clean under the denture without removing it. This denture will replace all your missing lower teeth and will not be removed except at maintenance visits. Although cleaning under your denture without removing it is more time-consuming and requires more dexterity, many patients who want permanent teeth prefer this option. The final option is to have all your teeth individually replaced so that they will appear to be growing out of your gum tissue and will most closely resemble the appearance of your natural teeth. This option usually requires 8 or more implants. Separate abutments or support posts for each one of these implants will be made and crowns for each missing tooth will be placed. The teeth are then frequently joined together for strength and support. Overall, this is the most costly option, requires the most implants, and may be limited by the current size and shape of your jawbone. A similar range of treatment options is also available for your upper jaw. However, because the bone is not as hard as that in the lower jaw, people often need more implants to support their replacement teeth. Depending upon the number of implants to be placed, it may be possible to eliminate the need for covering the roof of your mouth with the denture. This option will allow you to better taste your food and to better sense food temperature, and it will make your denture feel more natural. You'll still have a removable denture, which makes cleaning the support bar and denture much easier. If you want a restoration that is similar to your natural teeth and therefore not removable, you probably will need 8 to 10 implants placed. This is followed after healing by the placement of the abutments and crowns. Although it is natural to be concerned about the pain that may be caused by these procedures, most patients do not experience severe or significant post-operative pain. Pain medication and antibiotics will be prescribed for you to make your recovery as easy as possible. There is a nerve in your lower jaw that can occasionally be irritated during implant placement. This can result in numbness or tingling in your lip, chin, or tongue. Although this numbness will usually resolve, it can be permanent. Notifying us of post-operative numbness as soon as possible will allow us to manage your care in the most appropriate way. Post-operative infections are also possible. We will review with you what to look for in the event an infection develops. These problems will be discussed with you in detail at your surgical consultation and any questions answered. As stated earlier, surgery in our office is usually performed with a combination of local anesthesia and light sedation. Occasionally, general anesthesia is used, and you will not be conscious during surgery. The most common side effect of local anesthesia is a few hours of numbness following surgery. There are additional side effects of light sedation and general anesthesia, which include extended drowsiness, nausea, disorientation, and vomiting. In a small number of cases, allergic reactions to the medications and irritation of the vein where the IV has been placed can occur. This is called phlebitis. Do not eat or drink prior to surgery. This helps to prevent nausea and vomiting during the procedure if light sedation or general anesthesia is to be used. Ask your surgeon for the specific period of time you must not eat or drink. It is important that you be accompanied to the surgery and driven home by a responsible adult. In addition, you must not operate a vehicle or machinery for 24 hours following surgery. Other side effects may also be likely following surgery. These include bleeding, usually for a few hours, swelling of the inside of the mouth and on your face, discomfort, even muscle stiffness in the jaw or joint area. Transitory bruising on the face, lips, and or beneath the sides of the jaw can also occur. Tenderness or cracking at the corners of the mouth may take some time to heal as well. We will provide you with post-operative instructions that will help you care for these incidents. In addition, ice packs will help for the swelling and pain medications for the discomfort. If you experience an inordinate amount of discomfort, excessive bleeding, or have questions, please call our practice for additional consultation and direction. No surgical procedure is without risk, so our practice wants to ensure you're also informed about some of the complications involved with dental implant surgery. Post-operative infections are possible. We will review with you what to look for in the event an infection develops. In any surgery, bacteria are always present and may cause infection. Yet, infections generally respond to antibiotic treatment. If the infection is serious, extended treatment or hospitalization could be necessary. Complications may include loss of the implants due to infection. Please note that if an implant is lost, we may be able to place a new implant after good healing of the bone has taken place. Additional complications may include damage to adjacent teeth, fillings, or to the teeth roots. Complications may arise when surgery is performed in the upper jaw because the surgical site may involve the sinus cavity. These sinus complications require further treatment, usually with antibiotics, but sometimes with additional surgery. Some patients have jaws that are small or thin. During surgery, it is possible that a fracture may occur or that the roots of adjacent teeth could be damaged. Even when we thoroughly plan your procedure, actual surgery may determine an inadequate jawbone, deterring the completion of implant placement. Because each patient heals differently, there are no guarantees of the functional or cosmetic results of the planned surgery. Our goal is to inform you of the risks associated with dental implant surgery, enabling you to make decisions about your treatment and have realistic expectations about the results. Your restorative treatment begins with specialized impressions that allow us to produce a replica of your mouth and implants. We will also make bite records so that we can see the relationship of your upper and lower jaws. With this information, we will make the abutments that attach your replacement teeth to your implants. The number of appointments and the amount of time required for each appointment is different for each patient. No two cases are exactly the same, and regardless of the number of teeth replaced, the work must be completed with great precision and attention to detail. If you're having only a few teeth replaced, as few as 3 short appointments may be required. Between appointments, we will need time to complete the necessary lab work to make your replacement teeth. In general, once your implants are placed, you can expect your treatment to be completed anywhere from 2 to 12 months. For these reasons, it is difficult for us to tell you exactly how much the restorative phase of your treatment will cost. It also is difficult to give you a specific time frame for completion of your treatment until after the implants are ready for restoration. We will make every effort to give you a reasonable estimate of time and costs and keep you informed of any unexpected adjustments. We will try to assist you in estimating what your actual payments will be after we evaluate your insurance coverage or other third-party payments. If any, your ultimate restorative choice should be guided by your sense of what is best for you based on the information we've provided you. You also should consider the financial impact of each treatment option. Some insurance companies provide no or limited coverage. If different doctors are involved, they will charge you separately for their services. Each patient is unique, and it is not possible for us to discuss every option and every contingency for treatment outcome. This information is intended to help you understand the general treatment options available to you. If your specific treatment options are not clear, please contact us. We will be happy to answer any questions you have about your dental care. As with your natural teeth, it is important that you clean implant-supported restorations regularly with toothbrushes, floss, and any other recommended aids. You also should visit your dentist several times each year for hygiene and maintenance. Good oral hygiene is critical to the long-term success of dental implants. And as with regular dentures and other tooth replacements, your implants and their associated components are subject to wear and tear and eventually will need repair, including clip replacement, relines, screw tightening, and other adjustments. We present here a variety of treatment scenarios based on areas of the mouth which require treatment. Missing upper front teeth. In this first case, the patient is missing an upper front tooth. After the implant is placed, a temporary tooth is worn while the implant heals. A healing cap is placed and a support post fitted upon which the final restoration is placed. The next case shows 2 missing upper front teeth being replaced by implant-supported restorations. Missing upper back teeth. The first case shows implant placement immediately after tooth extraction. Bone graft material has been added to facilitate healing. This treatment plan avoids crown preparation of the adjacent teeth. The next case shows 3 missing upper teeth replaced by 1 wide and 2 regular width implants. The final crowns are attached to each other for strength and stability. The next case shows replacement of a missing upper molar with a wide implant. In this case, a sinus grafting procedure was also performed at the time of implant placement. Missing lower front teeth. In this first case, the space necessary to place a single implant was made wide enough by using a localized application of braces. After adequate width was achieved, the implant was placed and restored after healing. In the next case, 2 missing lower teeth have been replaced by implant-supported restorations. Missing lower back teeth. In this case, a missing lower molar is replaced with a wide body implant. The final restoration is not dependent on the adjacent teeth. The next case shows 2 implants replacing a missing molar. 2 implants are needed because of the space between the patient's natural teeth. The next case shows 2 implants replacing 2 missing molars. The patient's non-restorable molars needed removal due to advanced gum disease and cavities. We present here a variety of treatment scenarios based on areas of the mouth which require treatment. Missing all lower teeth. The first case shows 2 implants with ball attachments. This treatment plan can be used when your jawbone is big enough. The next case shows implants and a custom-made support bar, also called a hater bar. The specialized denture has clips on the underside to help the denture snap into place. The next case shows 6 implants in place. This support bar is made to mate precisely with the metal on the underside of the specialized denture. A denture like this can also be attached to the implants with screws and removed only at maintenance visits. The next case uses 8 implants to replace the patient's teeth individually. This most closely resembles a patient's natural dentition. Missing all upper teeth. This case shows how a surgical guide is used to ensure accurate implant placement. A custom-made support bar is placed on the healed implants, and the denture with special retention clips will attach to the support bar. Note that the roof of the mouth is not covered by the denture. The next case involves more implants and even less coverage of the roof of the mouth. This treatment plan may be indicated if your bite is heavy. The next case shows a patient who chose to have non-removable upper teeth. These teeth most closely resemble his natural teeth. A surgical guide was used to help with accurate implant placement. Missing all teeth. In this case, all upper and lower implants were placed at the same time using local anesthesia only. The specialized upper denture is removable by the patient for cleaning, and the lower denture is screw retained and removed by the dentist at maintenance visits. Patients can usually choose to have all their implants placed at the same time in both jaws, or have their implants placed as 2 separate procedures.